We're still watching this morning on ITV. It's the first talking point. We'll be looking at what the world has today, which is World Cancer Day. At our opening, we talk a little about what we know concerning cancer. But now we have an expert that will be, giving us details of what we should know that causes cancer, how we can prevent it, and of course, if there's treatment for it, how the treatment can be assessed. And here we have a general surgeon, Dr. Bashir Inusa. Very good morning and welcome.
Good morning and thank you for having me. Just an overview of what cancer is all about. Cancer generally is when there is an abnormal growth of cells uncontrollably in any body part, and these cells tend to grow beyond out of proportion, and they may even spread to a neighboring or a distant site. And this spread of the abnormal cells normally cause breakdown of the defensive mechanism of an individual's body, and this is usually detrimental to patient's life. So usually cancer has known causes or some recognized risk factors which are usually preventable.
So what are they?
Of course, commonly, common recognizable risk factors for cancers will include cigarette smoking, heavy consumption of alcohol, lifestyle like poor dietary habits. You see, commonly our dietary habits is tilting towards the Western diets. Westernization and adoption of Western diet has led to an upsurge of cancer in our environment. You see, most of our foods now are refined foods containing refined carbohydrates, saturated fats, junks. You hardly see people eating natural foods, vegetables, fruit. Okay, most of our foods are processed food now. Okay, excessive consumption of red meat. Of course, you know the white meat, fish and chicken are healthier than consuming beef and lamb products. Yes. Then inactivity, physical inactivity, lack of regular exercise. Okay, because if you have an individual with inactivity, that leads to what we call obesity. When you combine all these factors, including the poor dietary habits, okay, one tend to become obese, and that's a risk factor. Now, there are some certain infections, yes, that can also be preventable, like hepatitis infection. Okay, is a risk factor for transformation into cancer, human papilloma virus. Now, another important risk factor is genetics. Okay, when some abnormal genes, okay, that makes up an individual undergo some abnormal changes we call mutations, and these are inherited from parents, of course, to their offspring. This is also a risk factor for cancer.
Well, so many risk factors mentioned there. Cigarette is top on the list. Yeah, so why is it top on the list?
Yes, because cigarette smoking is found to cause various types of cancers. Okay, not limited to lung cancer, which is one of the commonest cancer worldwide, especially in the Western world. But it also generates some unwanted products in the body that can cause various types of cancer, not limited to only lung cancer. So that's why you see cigarette smoking usually top on the list, and it's something common among
You also talked about excessive use of alcohol.
Yes.
So how do we know when it is excessive?
Yes, when alcohol generally, when one has a habit of consuming alcohol, maybe daily, or alcoholics, is something that predisposes to chronic liver disease, and of course that can transform into liver cancer. Okay, so abstinence from alcohol is better than because it's very difficult for an individual to control the consumption of alcohol, since it's an identifiable risk factor. Okay, so abstinence from all the risk factors are preferable.
So how do we know the signs and symptoms?
Yes, the signs and symptoms of cancers usually depends on the part of the body that is affected. There are various types of cancer, and cancer can affect any part of the body. Any tissue that makes up a human body can be affected by cancer. And of course, the signs and symptoms, it depends on the time of presentation of the patient. Some patients normally present early, where you can actually detect and treat and cure, while some will present in an advanced stage, where you can hardly cure the patient. You only tend to control the disturbing symptoms. Now, the presentation, as I mentioned, will depend on the part of the body that is affected. For example, if you take breast cancer as one of the commonest cancer in women, the commonest cancer in women worldwide, they may notice a swelling in their breasts, or they will notice an abnormal discharge from the nipple, maybe bloody nipple discharge. Okay, and this swelling might progressively increase in size and may even be seen in other parts of the body when it has progressed, especially her armpits, her neck, okay, and some other symptoms may develop depending on the stage at which the patient presents to you. Now, all this presentation depends on the affected body parts. They have different ways of presentation. Yes.
Okay, so how about treatment? Because that is the major crux. Many people, you see them moving from pillar to post, from north to south. It's also one of the leading causes of medical tourism. So tell us about treatment.
Yes, there is this misconception that cancer cannot be treated. Usually cancer can be treated, especially when an individual presents early. Okay? And as a physician, when a patient presents early, your aim of treatment is to achieve cure. You want to cure the patient. But of course, if the patient presents at an advanced stage, you might have difficulty treating such patient. Now, for one of the means we use in detecting early presentation is by screening of a patient. Most of the time, we don't wait for a patient to develop symptoms for you to treat a patient. And there are various screening methods depending on the cancer that a patient has. There are patient may have breast cancer, you screen with mammography. Patient may have prostate cancer, lung cancer, and several other cancers. So now, if they are screened and detected early, they can be treated and cured. And there are various modalities for treatment. These modalities could include surgery. For example, if a cancer is an early cancer and you want to cure it,
completely.
Yes, completely. You just excise and remove it completely. And of course, before you do that, you must ensure it has not spread to other body parts. Because if it has spread to other body part, no matter how small it is, you don't consider it as an early disease. You understand? So surgery is a form of treatment. Now there are some other form of treatments like chemotherapy. It involves the use of drugs by oncologists, and of course they administer as appropriate depending on the cancer. Then other forms of treatment will include radiotherapy, okay, hormonal therapy, targeted therapy. All these are things that are in the medical field that they are indicated based on the type of cancer a patient presents with.
So at what time does the presentation becomes too late?
Yes, most of the time we consider cancer as late presentation when it has gone beyond the local site of affectation. So we consider a late presentation. In medical terminology, we call that an advanced disease. And there are two types of advanced diseases. It could be a locally advanced disease. It is advanced, affecting that region of the body where it's developed. Or the other type of advanced disease, we call it metastatic disease. That is a disease that has spread to distant site. So a patient that is coming with metastatic disease, you can consider that as it's too late. So your aim of treatment there is not to cure the patient. Your aim of treatment is just to alleviate pains in patient. So early disease, you aim cure. In advanced, that is locally advanced, that has not spread, your aim there is to kind of downgrade the disease, okay, to a size that can be considered as early. Then you can now offer cure. But when patient present with a metastatic disease, of course, that is, you can term that as it's too late. Now, what is most important about the treatment of cancer is the prevention per se. That is the most important aspect. Okay. Now, because the treatment might, because the treatment, you might treat a cancer completely and it recurs. Okay. So that's why prevention is considered even better. And prevention, you don't even want cancer to occur
at all.
Yes, and to achieve this, the most important thing is for you to identify those risk factors. Yes, if you identify these risk factors, as I mentioned, westernization and adoption of Western diet, you hardly see fruits being part of our daily meals now. You hardly see us consuming vegetables. Most of our foods are refined foods, junks, okay, red meat, okay, no exercise. Regular
the exercise is the most important one. But for people that have white collar jobs and the job is so tasking, what time will they have for exercise?
Yeah, that is a very good question. Of course, one has to create time, no matter how little it is, even before going to walk in the morning. If you live in a very safe environment or quarters or estate, you can do 10 minutes, 15 minutes, 30 minutes fast walking around within your estate, and of course take your shower and go to bath. The most important thing is to have a regular activity. Okay, just doing your routine walks, that is not considered as regular exercise. That is stress, and excessive stress might lead to fatigue, and that fatigue will even bring down your immunity, and bringing down your immunity is also a risk. So when you term physical activity, it has to be a routine and regular exercise. Okay, it doesn't have to be something very strenuous. Of course, you don't want something very strenuous. It will tire you out. Okay, so what you want is just a routine, regular exercise, fast walking, not too strenuous that you can even communicate while walking fast. That will suffice. So even though you have a white collar job, the most important thing is being organized and planning your time, okay, and utilizing your time well. If you can add this up with a healthy diet, okay, and prevent infections, like as we mentioned, that are transmittable, like hepatitis, okay, human papilloma virus from unprotected sex, especially in women. Yes, these are some of the identified infections that are risk.
Okay, I must say that we are really enjoying what you're saying, especially when it comes to the preventive side of it, which is cheaper and better. But at times, not everybody is aware that the preventive part is cheaper and better. When you have to come down with any kind of cancer and you are running from pillar to post to get diagnosis, you are on queue for treatment, you know, and your productivity, whether you are self-employed or you are an employee, you know, that your productivity is getting lower, and which to an extent may affect your level of income generation. So, but as a way of ensuring these things are done in on the preventive side, I'd like to ask how ready you think the federal government is, or the agency concerned. We understand there is NICRAT now, which is responsible for research and training for cancer. It's just a new agency, but generally your assessment on the preparedness of government to tackle cancer.
Yes. Usually when we talk about tackling of cancer at federal level, most importantly, as you mentioned, individual level is very important. But of course, one of the important ways the federal government go about preventing cancer is general health promotion and education. Of course, where mass media is used to educate, those programs like this, to educate the population about risk of cancer and preventive measures. And various educative programs are organized to inform people about cancer and how to go about preventing them. Then there are other preventive measures that are being utilized that are specific. Screenings are encouraged, like screening for cervical cancer in reproductive active women, sexually active women. Usually when they go for antenatals, especially in government hospitals, is the policy to educate them about the need to come for screening. Okay, they do a form of screening that is called pap smear. They take some samples and assess to see if they are at risk of developing such cancer. So these are some specific, just an example of specific. Then in hospitals also, we have federal hospitals and state hospitals where screening is encouraged, and the aim of those screening is early detection and to commence institution of treatment. There are various screening modalities because there are different types of cancers. So they are screening, for example, breast cancer, we do screening mammography. Any woman, usually a woman that is, every woman have a risk of 12% of developing cancer, breast cancer in her lifetime. Okay, but this risk will increase if she has family history. So normally one of the screening method that is done in hospitals and women are encouraged to do is mammography, especially those women that are 50 years and above. From 50 years they do 2 yearly screening mammography, and if their risk is higher before 50 years, from 45 they do yearly up to the age of 75 years. So other cancers,
from 75 you cannot have it?
No, you can have, but the risk has flattened. Because usually you have the risk increase from 35 years and it's steep up steadily. Okay, because it increased. Most cancers, especially adult cancers. There are pediatric cancers that are seen, of course, that is childhood cancers that are seen in the young. But most adult cancers are seen with increasing age. And it gets to a peak where the risk flattens and it continues steadily. Okay, so most of the cancers, specific preventions, then early detection by screening, breast cancer I mentioned with mammography, colon cancer, that is the large intestine with colonoscopy. Okay, all these 50 years above, when it reaches 75 years, okay, that means the risk has declined. Yes, then that is for early detection. Okay, then and treatment. When a patient goes beyond, or any individual that has gone beyond the age of screening, is already having symptoms. So you have treatment. Okay, you aim at cure if it is early. If it is advanced, you aim at palliation, just to better the quality of life of the individual.
Yeah, but it appears that in all the types of cancers, the breast cancer is one that usually comes with an option of removal. Why is it so?
Yes, usually, as I said earlier on, the treatment options vary. And one of the treatment options is surgery. Okay? And for all cancers that involve surgery as a treatment, when you remove the part that is affected, you can term that as cure, especially if it has not spread. But if it has spread, removal of that body part is of no use. Because if you remove the body part, it has already been deposited at a distant site. So what do you want to achieve? Now, the reason why you see in breast cancer, they offer them removal of the breast, okay, there are some parameters we use to assess. Can we remove only the part of the breast that is affected, not all the breast? That we call breast conserving surgery. Okay, so if that individual do not fulfill that criteria, you have to remove the entire breast, because if you remove only the affected part, she will come back with recurrence, and you don't know how the history will be like when it recurs. It might return with a more devastating disease. So that's why you see they are offered removal of the breast. Okay, there are some parameters the doctors look at. Okay, we cannot remove only the cancer, which the whole breast have to go. Now, this apply to other cancers. Okay, if it's involving maybe the intestine, that part of the intestine have to go. Okay, now, but the bottom line of removal of body parts or preserving a body part depends on the stage. If it is early, only that affected side can be removed without removing the entire body part. If it's already advanced in such a way that cancer cannot be removed, you have to remove the whole body part, because of course cancer, it's not limited. It has a way of infiltrating what is adjacent to it. Whatsoever is close to it, it just infiltrates. So that's why you have difficulty in treating, and that is the reason why you have different modalities in treatments. You might, if you employ a single modality, you might have challenge of not removing the entire cancer and a challenge of recurrence. Okay.
Okay, so we're about running up the discussion segment, but before we go, let's take a look at the various centers and, of course, the ultra-modern equipment for treatment of cancer. We understand there are just 6 of them, as big as this country is. Why?
Of course, you know, treatment of cancer is capital intensive. Okay, and it's an area in medicine where there is an ongoing research. Okay, every day cancer has a behavior in which the biology tends to change every day. So it's something that involves daily research. If you go to the developed countries, they heavily invest in research on cancers. Now, in our own centers, in the geopolitical zones, there are some centers that are designated for management of cancer, even though some of the facilities are suboptimal. But of course, patients still get cancer care. One of our major challenge is radiotherapy machine, okay, which in most centers they are suboptimal. You might go and see patients on a long waiting list. Even those centers that are designated for treatment of cancers, most of the time the machines are faulty. Patients have to resort to private care, and these are very expensive. They are usually not affordable, and some of these are not readily made available for our NHIS programs. And so it's really difficult for most Nigerians
to pay?
Yes, to pay, especially those. We are not even talking about early cancers that you want to achieve cure. There are so many things we don't do about that, like genetic screening that is not even available. Even if it is available, it's not affordable. Yes. Then for the available ones, what I will say, it is grossly suboptimal.
So as we speak, there's about 10 billion naira allocated for cancer research and training. Perhaps it may even be, treatment may be part of it. It is now transferred from the Federal Ministry of Health to the National Institute for Cancer Research and Training. That happened last week. About 10 billion naira. From what you are saying now, is that amount enough? Should that be more?
Well, cancer treatment, because it's a multidisciplinary approach, is something that requires re-evaluation and assessment of what we need and the budget that is allocated. Will it be enough or not? So it's something that will require continuous re-evaluation. What we have on ground, what we need to cover. Okay, what is our population? In our population, how many individuals are affected with cancer? In the children population, the adult population, even the elderly population. Okay, so it's with this, when we have good statistics and record and evaluation of what we have on ground, that's when we can project, okay, this money, one cannot conclusively say that is enough until you have details of statistics of what we have and what is even the population of cancer patients, what types of cancer, what is the pattern of cancer we have, what do they require, okay, for the treatment. If this money is evenly distributed, will it solve our problem? So, in other words, what I'm trying to say, we need data on what we have on ground and what has been allocated. Will it be able to solve our problem or not? But it's going to be difficult to conclusively say if that amount will be enough or not.
Okay, before we go, let's get tidbit from you again on how to stay clear from cancer. General advice to the public.
Yes, cancer, as mentioned earlier, is a very difficult disease to treat, and this disease is preventable. And some of the preventive measures will include lifestyle modification. And this lifestyle modification will include abstaining from cigarette smoking, okay, abstaining or controlling alcohol ingestion, because heavy alcohol ingestion is related to cancers. Then physical activity, avoiding inactivity, because if you have a regular exercise, it's a preventive measure. Then healthy diets, okay, we have to take healthy diets that is rich in vegetables, fruits, whole grains, okay, white meat, fish and chicken rather than beef and lambs, okay. Then of course screening, okay, especially to detect cancer early. So this screening involves you consulting your physician that will educate you more on how to go about that. It will involve physical examination of your body, some blood tests, urine tests depending on the type of cancer, and there are some imaging like x-rays, ultrasound scan and so on. So these are in a nutshell some preventive measures we can take.
I must thank you so much for your time with us, Dr. Bashir Yunusa, General